My entire journey really started from loving the profession and then having a feeling that I could no longer stay in it. It's the artist known as burnout. And it just is, we just can't let this happen to our doctor colleagues, our nursing colleagues, our physical therapist colleagues. And we have to address these policies upstream that are resulting in us knowing what to do, but not being able to do the right thing. And it is going to be the honor of a lifetime as a member of Congress to advocate for these things for us in healthcare.
Hello and welcome to the Fire Chief Podcast, the only podcast dedicated to the Chief Medical Officer. I am your host, Lee Scheinbart, and this podcast brings you the hottest and most crucial conversations in healthcare and physician leadership. Today's guest is Dr. Tina Shah, a practicing pulmonary and critical care physician and candidate for Congress from New Jersey's 7th District. Dr. Shah is a national expert in workforce burnout, AI, and health policy, and was recently the chief clinical officer of Abridge, an ambient AI company valued at over $5 billion. Dr. Shah has served in 3 White House administrations as the National Director of Wellbeing in the U.S. Department of Veterans Affairs and as Senior Advisor to the U.S. Surgeon General, where she created the nation's strategy to address the Great Resignation and burnout in healthcare. Dr. Shah earned her undergraduate degree from Penn State University and her medical degree from Thomas Jefferson University as part of an accelerated 6-year combined program, and then trained in internal medicine, followed by a fellowship in pulmonary and critical care. Dr. Shah has also earned an MPH from Harvard University. And I have to do this. Tina's favorite activities, and I quote, include pondering a society where going to work helps us thrive, playing volleyball, and changing hearts and minds. And with that, Tina, welcome to the show.
Lee, with that kind of intro, I'm not even sure what to say next. I mean, who's with me to ponder life's biggest questions?
I am. And I want to ask you about that. I mean, I'm thrilled to have you on the show, but I'm thinking, well, what happens when you're bored and you go one level down and you're done pondering hearts and minds? So do you do underwater welding or rattlesnake venom collecting or redesign the entire U.S. public health? Because if that's what you do, I'm voting for you, period. End of discussion.
I love it. Here's a big secret, Lee. I happen to be just a human. I oscillate between reviving my plants. I'm a plant lady. And I'm falling into the pit of Netflix. I got to say, I love it.
Be careful out there. Be careful. Look, you are serious about leadership. You are no stranger to the roles. And I want to know, and I know our listeners want to know, what have you done over the course of your career to cultivate some of the skills that you find necessary to succeed as a leader?
The best part about this question, especially given some assumptions, I'm assuming many listening in are physicians as well, is that we were trained to be leaders. We self-selected because we're leaders. We started off with a foundation that might not have been called leadership, but that's exactly what it was. And I think the biggest thing that I would want to share is that as soon as I started to feel uncomfortable, that's where my leadership challenge started. I think many people have the potential to be incredible leaders. But the question is, when you feel uncomfortable, do you decide to do something about it, get curious about it, seek help, seek feedback? Or do you decide to go on with your day and put it on the side? I won't lie, being a candidate for Congress has definitely put me in a near daily state of feeling uncomfortable. And I'm feeling stretched. I'm stretching, I'm growing, and that is how I'm continuing to build my leadership.
Those are great lessons. I do think it's a requirement of leadership, and I've put a lot of time into studying it and teaching it. Curiosity is a critical element. And to your point, then stretching yourself when you feel that curiosity or the stress, whether it's good or bad stress, and to engage with it and stretch yourself out of that comfort zone. Because as you say, we get trained, we do our jobs, we become competent clinicians. It's when you stretch is when you grow, right?
Yeah. That's right. And I feel like this is a combination of a few things. I love reading. So I think although I have a little less time now, but some of my favorite books really harken back to the to the improvement section and the deep introspection section in the bookstore. I still go back to 7 Habits of Highly Effective People. That's a classic. There's so many amazing books out there. So I think about things happening to me and then reading these books and connecting the dots and trying to unpack experiences I've had. I am a proud advocate for coaching, executive coaching. I think this is really helpful as you're navigating managerial challenges, especially. And I also think having that board, your own personal board. Who are the 5 people? And maybe they come in and out of your life. It may not be the same 5. Who are the ones giving you professional feedback as you go on your leadership journey?
Yeah, absolutely agree with that. Okay, so let's talk a little bit about where you're headed. So prior to your announcement this past July to seek the nomination of your party in your district to move forward, tell us one of the most particular policies or accomplishments that you are most proud of. You can pick a government policy or something in the government world. What is something you're most proud of in the recent past?
I feel like the best stuff I've ever done, Lee, has come off of getting really frustrated and frankly pissed off. And I'm going to tell you a story that I know it was going to resonate with you and probably everyone else listening. But let me just tell it to you straight. We've seen this many times in our road as practicing docs, but I'm just going to give the story of my mother. My mother had chest pain. It was classic. She's got enough in her background that she should have gotten a cardiac cath. And shocker, not shocker, the cardiac cath got denied by her insurance company. We see this story again and again. I don't know why, but we're living in this world where in the exam room is the doctor, the patient, and the insurance company. And my proudest achievement was working in New Jersey in a bipartisan way to take a healthcare bill that would have reined in the excessive use of prior authorizations and getting it from dying on the vine to having such a groundswell of social media influencers, doctors, nurses, patients writing letters that it passed with only 1 dissent last year, went into effect this year. And now for plans that are regulated at New Jersey state level, you can have your care denied. And an insurance company can't take 2 weeks or 14 business days to respond for something that's more urgent. That's been my greatest achievement.
Well, you have a lot to be proud of, and you just turned on a light bulb in my brain. When I started practicing medicine, it was generally myself and the patient and caregivers and family. So sort of a very simple binary situation. Later in life, for better or for worse, we had a digital tool, a computer, a device, whatever, in the room with us. But I began to look at it like, the stethoscope or taking a blood pressure. It's just another thing. But you said the third thing that has entered our examination rooms is the insurance, the payer. That is a very, very deep insight that I have never really put together. And you're absolutely right. And I believe in the future, those real-time experiences are literally going to be right there because you're going to hit a button and you're going to get a big red no or denied right in front of you, not 2 weeks later while you're waiting anxiously to find out if somebody has a mid-LAD stenosis or something like that. So kudos, hats off, well done, a lot to be proud of. And I hope you can do more should you get to the House of Representatives. So thank you for that. Okay, next question.
Go for it.
If you get to the House of Representatives, it has been stated by several people that have been on this show who are in a variety of positions, either in the past or currently in government, and that politics today is inherently adversarial. We're caring for patients. There's a lot of other bedside clinicians. We're leading teams. That's hardly adversarial. I mean, we get bad behavior, but that's not what I'm talking about. We're working as a team for your mother, for this patient, what have you. How do you plan to approach the notion that it's adversarial, even if in Jersey you got a strong bipartisan support for what you just described, but in DC it's perhaps different?
I love this question. First, let me just say it's not a question of if I get into Congress. When I get into Congress, and let me be clear, it's actually going to be January 2027. That's when I'll be showing up into Congress. I'm the front runner in my race, Lee. I'm going to do whatever it takes. We're doctors. We work hard. We're not going to stop when it's something important. And I will also say this, going back to our physician roots, when we take care of patients, when I take care of patients in the ICU, I have no idea what their political affiliation is. It doesn't matter. I don't ask who they voted for. I don't ask who they support. I just take care of patients. At this point, healthcare is being dismantled at such a fast clip that this is about coming in and bringing the medical expertise to the table to make sure that we stabilize and stop the destruction and find those opportunities and improve the system. I'm planning to bring this same energy to Congress. I will work with anyone who's willing to work on improving the healthcare system and lowering costs. And the best part about coming in as a doctor is that healthcare is cross-cutting. It happens to be top of mind whether you're a Republican, a Democrat, an independent, insert your party affiliation here. Everyone is feeling the pain. I mean, there's so much friction in just trying to get basic things. That's where I'm going to start. I think it's fairly simple when you're a doctor, and I don't mean to be glib about it, but it's about people.
It is. It is. And right now, obviously, you and I are watching from the sidelines, and hopefully you're in the arena where it will happen. We're in this government shutdown, and one of the loudest positions is blaming the other side for not going forward relative to some real serious concerns about healthcare. And we're not going to get into it today. I'd be happy to bring you back and talk about that. But that's where reaching across the aisle and getting people to open up to the concept. This is about people. People are stuck and people are potentially in harm's way because we cannot reach across and resolve this like in days past. So in January of 2027, right? That's your target date when you get inaugurated. Okay. So when you're there and you're looking at all these structures and all these scaffolds and things that are impacting both the clinical workforce and our patients, and particularly some of the financial harm and toxicity to patients, are you going to volley for the long point, or are you going to spike the ball over the net? Like, are you going to go in rushing, or are you going to methodically work your way through some of these challenges? What's your thoughts?
It's so hard to predict what the top issues are going to be in healthcare by the time we roll around to the next Congress. I think we have trouble even predicting what the administration is going to do in the next 2 months when it comes to healthcare.
Fair point.
My job is to figure out what's the lowest hanging fruit because people are hurting. I'll just be honest with you. I'm buying insurance on the exchange, and I just got a notice that my health insurance is being canceled. And I know not only do I have to shop for a different plan, my premium is going to go up at least 16%. So whatever it is, I'm looking at affordability and accessibility, and that's what we need to shore up. But also, can we talk about this threat to science? I mean, how is it that we're putting anti-vaxxers on the vaccine board, on ACIP? So I will be looking to restore the things that are foundational for us. Trust in experts, trust in data, trust in science. Let's put scientists and medical experts back in these positions guiding our country. That's what I'm most excited about. And also building off of what I was able to do in New Jersey, leading a grassroots coalition, I really think we need to address big issues like prior authorization. We need to take what's happened in the states, like in my state, New Jersey, and now do this on a federal level, because the whole goal is if I don't feel well or if I want to stay well, it should be easy for me to do that. I shouldn't have to go through that many hoops and pay these exorbitant copays and deductibles.
Yeah. I echo that. It should be easy in a world that we can get something from Amazon overnight. We should. I mean, have you ever clicked on Amazon and you get denied? You cannot get that 6-foot cable that you just ordered for your television.
No,
Never happens.
right?
All right. This is a longer question. All right. On your website and in press releases, you have been very, very consistent that there are not enough physicians or others in clinical medicine or expertise in Congress advocating for science, expertise, the voice of medical professionals and biomedical scientists. And we, doctors, I'm looking at myself, by and large, remain aloof, if not agnostic to the politics. And while we have our opinions, many complain a lot, but they don't do anything. They don't take the action. And granted, they're busy taking care of patients. But do you think if that is something that should change or could change, what kind of thoughts do you have? You want to change hearts and minds, or at least you think about it. How do we draw that physician voice in, or are folks like you, the representative voice, like, how do we do this?
First step, Lee, is electing more doctors like me to Congress. We only have 21 doctors in Congress right now. It's close to 5% of the, entire elected body, but our healthcare budget is 21%. 21% of, our budget is healthcare. So we need to have people that are talking about and making policy when it comes to healthcare that have actually been on the front lines and understand what happens to the medical workforce and also to the patients and their families. As a doctor, we've honed our ability to listen. If we don't, we can't make the diagnosis. And that's going to translate to when I'm in Congress and when the other doctors that are running are in Congress, we're going to hold these town halls. We're going to listen to people. And that is how we're really going to bring in the expertise that we need when it comes to healthcare. What are the issues and how do we fix it in the right way? I also have to say, we train so hard as doctors. It's understandable why when we go the extra mile, it's the extra mile for our patients. What I will tell you, though, as a congressional candidate, is that I have been overwhelmed by the support from our physician community in these first 3 months since I've launched my congressional race. Physicians are understanding. We're seeing what happens when Medicaid gets cut. We know exactly what's going to happen to our ERs. They're going to be overrun. People are going to be using the ER for routine dialysis. This is insane. We know that our practices are going to close. I can't believe this should not be death of the private practice physician. We have to protect everybody. And what I know now is that I've watched our community step up. We may be newer to it than other industries, but people are stepping up.
I would, yes, agree with all of that. And when we talked about having the insurance company in the room, sitting squarely between us, you and me and the patient, this structural anchor on us in the midst of caring for people, both robs us as physicians of the requisite time to engage in something like this, right? At the end of the day, I am looking at a lot of paperwork, although it's all digital, to move things along, to get the CAT scan approved, to get the diagnostic cath or the diagnostic mammogram or ultrasound, whatever it is I'm trying to do, I'm trying to move through that mess, not to mention the charting. Now, I think with your work in Abridge and others, we're going to get some relief around charting, but we also need that structural friction to reduce to get our work done. And I think that also wears us out and our willingness to engage in, like you said, we know what the problems are and we know exactly what the outcomes are going to be relative to Medicaid and accessibility and affordability. But we run out of time and strength to actually do anything. So I think your vision of it is very easy to understand as a working physician and why it's hard and why we don't all have the same steam and energy to push back on some of this stuff because it's around our necks in a way.
That's right. I mean, to ask someone who's treading water to go take care of something else, like to go fishing at the same time, how can you even do that?
Yeah.
But what I will say is that what does it mean to be a physician today? It means to diagnose a problem and to fix it. And we are branching out in every which way, myself included now, moving into politics and really trying to steer the ship and address some of the upstream things that then put that albatross on our neck because we're having crushing paperwork, as you mentioned, digital mostly, but crushing nonetheless. We have to address things at all angles. My entire journey really started from loving the profession and then having a feeling that I could no longer stay in it. It's the artist known as burnout. And it just is, we just can't let this happen to our doctor colleagues, our nursing colleagues, our physical therapist colleagues. And we have to address these policies upstream that are resulting in us knowing what to do, but not being able to do the right thing. And it is going to be the honor of a lifetime as a member of Congress to advocate for these things for us in healthcare.
Yeah, absolutely. Well, what if a couple of our listeners are thinking about following in your path and to the extent that they haven't had as close a relationship with former U.S. Surgeon Generals and health policy and the IHI and so on, but they're like, I've got to do something to fix this, right? And they want to physically be in the room where it happens with you on a committee, et cetera, et cetera. Where would somebody who doesn't have the type of background that you have, where do they begin? Do you have any opinions on the matter?
Many. First, I just want to say, if you are thinking about it, yes, yes, yes. And we're not just talking Congress. Guess what? You know what's really important? The school board. You know what's really important? State legislature. Being a mayor. All these things have massive impact on daily lives and how we structure U.S. healthcare. I would say talk to your local elected officials. Understand what's the mayor's purview when it comes to daily life and healthcare. Send a note to your governor. Send a note, and by that I mean a phone call or an email to your member of Congress and request a sit down. They will take it. So talk to people that are within arm's reach. When you're a constituent, all your local elected officials automatically are your friends. As in fact, they have to call you back, so they will. And I think that's where I would start. I also want to highlight 314 Action is an organization that literally was founded to help doctors and other STEM candidates run for office at every single level. So they recruit, they train, and they support doctors. I am a beneficiary of working with 314 Action. And what I would say is this organization knows how to speak doctor and can take us and show us a playbook of what it means to run in these various positions. Whether you're thinking about doing something in 15 years or you're thinking about doing something in 1 year, this is the organization to start with.
314 Action.
That's right. Just like pi, 3.14.
That's too funny.
Yeah. And
Is that for real? Is that the connection?
That is a connection. And for anyone listening, if you reach out, tell them Tina sent you, because you know what? It's about time we get more of us physicians in all these different places.
Yeah, that it is. Agreed. Again, we are of one mind. Okay, so in the interest of your time, you have a lot to do. What else would you like to convey to our listeners, aspiring physician leaders, non-clinical healthcare leaders, those interested in the same things you're interested in? What would you like to share with them?
We really need to elect more medical experts, physicians, to Congress. So I'm going to make a shameless plug, which is to say, I would love for you to keep abreast of what's happening with my campaign. And I can't wait for us to celebrate the successes together. My website is www.drtinashahforcongress.com. And I hope you can join, you can chip in, you can sign up to volunteer. This is it. This is it, Lee. It's time for all of us to step up. And let me just share with you that it is the time that we step up by our voices, that we step up by contributions to candidates like myself running, and that we step up and say, look, we've trained for a great number of years. Science is real. Fact is fact. And that's how we're going to protect our patients.
Well said. And thank you. You know, when I started in medicine, that insurance company was not in the room. The only way to get them out of the room is doing exactly what you just said. And it's time we get that done. Well, thank you so much for being on the show. And thank you for everything you do in healthcare, especially within the House of Medicine. We can never have too many leaders in the House of Medicine or in the House of Representatives. It's a fact. So you have been listening to the Fire Chief Podcast, the only podcast dedicated to the Chief Medical Officer. And if you want to learn more about what it's like to be a CMO or how to get involved in public policy or government, check us out. Check out our website, thefirechiefcmo.com. Check out Tina's website. Check out 314 Action. And listen, I love talking with physician leaders and CMOs from all over. So get out there, be a chief, run for office, get a new hobby. And in the words of Sergeant Phil Esterhaus, let's be careful out there.